face-to-face meetings, courses, and other activities during the 2020 coronavirus pandemic. But Pioneer has become so much more than this in the intervening year. Pioneer is a virtual, but also very real community of like-minded orthopedists striving to help not only themselves, but one another. With the latest video conferencing and educational technology, as well as a groundbreaking online platform, SICOT's Pioneer events, activities, and resources are reaching every corner of the globe, with over 55,000 views of our webinars so far. We're forging new partnerships, signing agreements with 12 other international academic societies, and building an enduring network we hope will last for many years to come. So, what can you expect from us? Free webinars led by key opinion leaders from around the world and across all fields of orthopedic surgery and traumatology, as well as chat shows with some of the most interesting and inspiring surgeons on the planet. Opportunities to take an interactive role in these webinars by participating in polls and live discussions. Free on-demand Pioneer playback service. Watch our webinars again and again in your own time. And coming soon, our new bespoke learning management system will host podcasts, an online version of the famous SICOT diploma exam, virtual training modules, surgical technique courses, a discussion forum, and much, much more. We hope you'll join us on this pioneering journey as we push the boundaries of what is possible in online orthopedic education together.
Welcome to the SICOT Pioneer Webinar Series. I'm Dr. Margaret Fogg from Hong Kong, the SICOT Education Academy Chair. Before introducing today's chair and faculty, I would like to share some background in the SICOT Pioneer initiative. SICOT Pioneer is part of the SICOT Education's virtual platform, which launched in June 2020. Since its inception, we have basically organized 113 webinars and 7 tete-a-tete sessions. To date, the platform has garnered over 50,000 live views and over 93,000 on-demand views. We are also proud to have a Pioneer fan club of over 14,000 web members. If you'd like to explore previous webinars and other education activities, please visit SICOT website at www.sicot.org. We also encourage you to join as a member to access these resources on demand. Today's webinar is organized by our SICOT Research Committee. The topic is From Ideas to Questions, a practical roadmap to start your first orthopedic research project. Our moderators, our moderator is Rob Neal, Kenny, and as well as Dr. Prakrit Chhetri from Nepal, who's our SICOT Research Education and Membership Committee. So without further ado, I will hand over to our moderators, Dr. Prakrit and Kenny, please.
A very good morning, good afternoon, and good evening to all of you across the world. We are very excited.
Dr. Chhetri seems to have a connectivity issue. You can go on in the meantime.
Okay.
Maybe Prakrit, yes.
Yeah. I'll take over. Okay. Good afternoon, everyone. The SICOT Pioneer webinar series proudly presents From Idea to Question, a practical roadmap to start your first orthopedic research project. It's an interactive session designed to help clinicians and researchers transform everyday clinical observations into meaningful and publishable research. It's led by an international panel of experienced researchers, editors, and educators. And this webinar will provide practical guidance on identifying research ideas, developing sound methodology, using AI ethically, selecting appropriate journals, and successfully navigating the publication process. So without further ado, I'd like to call upon the first speaker, Dr. Chun Man Lawrence Lau, who is a clinical assistant professor of orthopedics and traumatology at the University of Hong Kong, specializing in advanced robotic-assisted joint reconstruction and medical artificial intelligence. He is the recipient of several national and international awards and serves in the editorial board of BMC Musculoskeletal Disorders, Arthroplasty, Asia Pacific Journal of Sports Medicine, Arthroscopy Rehabilitation and Technology. He contributes globally as a member of both the Digital Orthopedics and AI Committee and the Hip Arthroplasty Committee, and additionally serves on SICOT's Research Education and Mentorship Committee. I'd like to invite him to speak on seeing research in daily practice. Thank you.
Good morning and good afternoon to the dear SICOT community. Can you hear me? Just to confirm.
Yes.
Yeah, thank you. So I'm Dr. Lawrence Lau, Clinical Assistant Professor in the Orthopedic Department in the University of Hong Kong. Just like the background as shown here, I shall be discussing with you on how to see research topic in daily practice. So first of all, most of us are surgeons that have to handle tons of different patients. And despite we are being educated, we are not almighty. And so usually we face various challenges to tackle the challenging clinical scenarios. So in order to solve these problems, as described in these recent BMJ articles, we are now in need of a learning health system. So in a learning health system, data and experience are systematically analyzed, integrated, investigated as evidence, and then this knowledge is put into practice to benefit a better and more efficient patient care in the future. So the key is that every problem should originate from a real challenge that you face clinically and to think of a method or answers to it. So in the end, you apply the solution back to the patient. And in fact, many of these clinical questions come right in the every moment of your clinical practice. And I shall share some of my personal experience with you on how they are translated into research. However, given the interest of time, we can only discuss 3 of them here today. And the following are some of my examples. So during the COVID period, we observed there are increased number of patients reporting joint pains and arthritis. So was it a coincidence? The key is to notice something that are unusual and uncommon, deviating from the norm of usual practice. So with a good research mind and medical knowledge, you will notice that actually many viral infections relate to joint pains and even chronic arthritis. And for example, the recent popular Chikungunya viral infections. So with this in mind, our group looked into whether SARS-CoV-2 could cause arthritis. So after identifying some patients develop arthritis rapidly after COVID, we tried to reproduce this phenomenon in a hamster model. We found that SARS-CoV-2 can activate the endothelin-1 signaling pathway, and this leads to increased vascular permeability, the leak of viral spike protein into the subconscious bone and causing the arthritic change. So with this finding and its potential treatment, our group had published the results in the Nature Microbiology Journal in 2024. The key here we illustrate in the first example is try to be observant every time and take notes of every minor details in a daily practice. And here is other examples. Since I'm a joint surgeon and also do sport medicine, when I noticed when I do the ACL reconstruction or joint replacement, there are quite a number of patients having PCL tear without being previous diagnosis. So can we do better and can we improve the patient care? However, recognizing PCL injury are challenging because they are commonly missed due to their subtle clinical size. So some common modalities like the MRI has high accuracy, but they are expensive, time-consuming with low sensitivity towards chronic tear or other conditions. So when I see this problem, I actually see a solution. Why not use ultrasound as shown here? Because ultrasound can also identify the PCL. But moreover, I see the problem of my solution. Ultrasound is accessible, cost-effective, but it is operator-dependent and not a streamlined quantitative tool. So beyond that, I further see a solution to the problem of my solution. Why not use AI? Because AI can make the whole assessment process operator independence. So in the end, we published this paper in the MPJ Artificial Intelligence, which is part of the Nature Family Journal. So in these examples, we illustrate that the problems has already been in the daily practice. It matters not what you want to see. It matters whether you want to see it or not, and whether you can see beyond what you are seeing. So what if you know nothing about AI or any basic science? You can always share your experience as a surgeon. So here's our experience. This is a lady, elderly lady with a total pathectomy done many years ago. There were excessive medial laxity, rotational malalignment, and lack of an extensor fulcrum. So in this challenging scenario, we combined multiple techniques to manage this patient. We make use of an image-based robotic totally arthroplasty system to accurately execute the correction of limb alignments and bone cuts for totally arthroplasty. And we also sized the removed bone block to form a new patella for her. And we also checked the rotational alignment and the patellofemoral joint checking of the Leo patella using the robotic system. And in that case, we successfully managed the challenging scenario by combining multiple technologies and achieve a good clinical result. The patients could walk unaided at 2 years follow-up with full power of knee extension. And we published our results in the Orthopedic journal recently. So the key is that to see research in your daily practice, a meticulous care for your patients is the foundation. So far we have covered different disease patterns, and also we think what you are doing and some interesting patient case. In fact, the major common source of research idea comes from your daily practice, which is what occurred during your clinic follow-up. So by following up your patients, you can publish a lot of papers. For example, as shown here, we published a paper on the cementless acetabulum components on 20 years follow-up. Another article with 17 years follow-up of open wedge high tibia osteotomy, and another one on arthroscopic band cuts repair with 17 years follow-up, and another one on long-term follow-up of low limb arthroplasty, and another one on the use of computer navigations on totally arthroplasty. So, like here, as shown here, is that try to make use of the everyday materials like clinic follow-up for your own research. So here is a framework for you to consider when seeing research in your daily practice. Is the problem frequent? Is there a method that you can measure the observation reproducibly? Is there a genuine problem, and how can you compare it? And can your team have enough resources to answer the questions? So try to turn this self-questioning into habits. Ask it once a week or once a month, and formulate into a research parties or research meeting. So in fact, as mentioned in my examples, you can publish it as case reports, cohort study, or even RCTs. And not every question requires the same research design. So the take-home message is that try to see the problems in your daily practice, structurize the problems, and connect the problem with a solution, and try to apply it back to your own patients. So with this, I would like to thank the SICOT committee for giving me the chance to present on this topic. And so research is seeing what everyone sees and asking how we can learn further from it. Thank you very much for listening.
Thank you very much, Dr. Lau, on enlightening how the everyday problem in your OPDs and finding solution to it can also be turned into research. And equally important is how your research is seen from the editor. So to speak on tips in actual publication from editor's view for young researchers, I'd like to invite Dr. Anna Cohen-Rosenblum, who is a specialized orthopedic surgeon at New York University Langone Health and a prominent leader in the global medical community. She serves as the vice president of the Ruth Jackson Orthopedic Society and is a deputy editor for the peer-reviewed journal Arthroplasty Today. Internationally, she champions the development of early career surgeons worldwide in her role as chair of the SICOT Young Surgeons Committee. Welcome, Anna.
Thank you so much for having me. And this is a great segue, hearing about how to develop a research project and now how are you going to publish it? So here are my disclosures. My biggest disclosure here is that I'm the Deputy Editor-in-Chief of Arthroplasty Today, which is a adult reconstruction journal owned by the AAHKS, the American Association of Hip and Knee Surgeons. So I'm speaking to you in my capacity as an editor to help you get published. So we're going to go over how the editorial process works, some tips for getting published with original research, case reports, how to get ahead in journal infrastructure, the use of AI, which I think is a growing issue that's come up in publication, and then I'll conclude. So how does it work when you submit a manuscript? So you're going to submit it, then it's reviewed by our managing editor staff, and they look into, is it formatted correctly? Do you have a consent? Do you have an IRB if necessary? And this is why it's very important in order to avoid delays in publication that you review the specific journal author instructions, because they're going to have specific things that you'll need to do in terms of formatting and stuff that will prevent you from having it immediately rejected and sent back. Then it goes to the editor. So that would be, for example, me or my editor-in-chief. It gets run through in our journal a plagiarism software to look for, as you see an example here, any similarity between other published articles that are out there to see if we're concerned at all about any issues with plagiarism, because if there is, we don't want to be reviewing it. And it'll look to see if the article has been submitted to any other Elsevier of these journals, because that's very important that when you submit an article that it hasn't been submitted simultaneously to another journal. If you've submitted it elsewhere and it's been rejected and gone through the peer review process, or you've decided against publishing in that journal, that's totally fine, but it can't have two submissions at the same time. Then peer review occurs. So what happens is we choose reviewers for the study that we think are subject matter experts, and then we wait for the decision. This is the big bottleneck, and it's going to sort of tie into what I'm encouraging you later in my talk about reviewing. It's hard. It's been hard lately to get good reviewers. Sometimes reviewers will sort of ignore our requests or take a while to do it. So it's a very important part of the publishing process, and we encourage you as well to volunteer to review, to pay it forward. If you've had your studies published before, help us review good studies and get them out there. The decisions, depending on the journal, is pretty rare to have a study that's accepted right away. Usually there's some kind of, maybe small, but there might be some minor or major revisions that need to get done. And then you'll get a decision that said revised, and then you'll need to resubmit with the requested revisions within the time frame that we ask of you, or it'll be rejected. So when you're submitting original research, some tips to help you succeed in publication. The introduction should include a hypothesis. The method should have clear exclusion and inclusion criteria. It should be powered to detect the primary outcome. Your results should match what you discuss in the method. So what you can't just report a result that you didn't mention in the methods that you're going to be studying. Avoid excessive figures and tables. It just kind of clutters things up. In your discussion, you're talking about your hypothesis. You should include that in the discussion. Do your findings conform to that? And of course, any study is impossible to avoid bias, but please discuss it in your limitations, what steps you've done to mitigate that, whether it's selection bias or confirmation bias or a non-response bias if it's a survey. In case reports, so not every journal publishes case reports. Orthopaedic Today does. When you're doing a case report, before you even start, just think to yourself, what useful information does this case report provide for, in our case, arthroplasty surgeons, or any, depending on what subject or subspecialty your case report is. Your information should have thorough background information, the case history, and I brought an example of a recent case report we put in Orthopaedic Today, but it should include in our journal that you've obtained written informed consent from the patient for publication. Again, this might vary on journal, but in our journal, that's what we request of you. You should have detailed surgical techniques, including your surgical decision-making process and good quality photos or video, because again, going back to my first point, this needs to be not just like, oh, this is a cool case we did. We want other surgeons to learn from you and learn from your surgical decision-making and your technique. So that should be included, not just we perform this procedure. And again, in our journal, we want at least 1 year follow-up with imaging from the most recent follow-up. Again, that might vary from journal, but we think that having 1 year follow-up is important to know, how everything went. And your discussion should have a literature review if that's applicable. And again, going back to my first point, actionable points for readers. How to get ahead in a journal. This is a little fun AI graphic we did to try to recruit reviewers, but we want people to review. Reviewing is a great way to stay up to date on what's going on, get ideas for your own research, and provide a key service for the journal. So we really encourage you to do that. And this will provide you with opportunities to move up in the editorial board. We pick our editorial board based on who provides timely and good quality reviews. So if you're interested in doing that and adding to your CV, the first step is to provide timely, high quality reviews, and then send us an email. Hey, I'm interested in being your editorial board. My record speaks for itself. I've done 20 reviews for you over the past year. They're all on time. They're all good. We'd be welcome to welcome you to our editorial board in that situation. We do rate our reviewers. So every time a review gets done and I'm the editor for the study, I rate how good the review is. So that's part of your record as a reviewer. The use of AI. So this has come up recently. The benefit is it can be very useful, especially for language editing. However, it does have many problems, including it can hallucinate references that don't exist. So it's very important to have human oversight on the AI if you use it to help craft your study in terms of the writing and the editing. You need to edit it yourself and make sure that, because you're responsible for the information that's in there. You should definitely check each journal policy for how they approach AI. And it may be different for each journal. I put an example of our AI policy here where I'm not going to go over it, but this is a very important thing that you should do before you even submit your study so that you know the correct statement you need to use if you're going to be using AI in your study. One key point I want to make, do not use AI for reviews. All right. So I'm spending all this time saying, oh, you should review for us. If you use AI for a review, it involves uploading an unpublished manuscript into often OpenAI, and that's a big problem because the whole point of this is that we need to have the peer review process and go through quality control. So that right now, at least in the form of AI being what it is, and our journal, we do not allow for using AI for reviews. So in conclusion, all journals want impactful research, okay? Always read the guide for authors, okay? This will save you time on the back end in terms of getting an immediate reject because you didn't do the formatting or didn't include a consent that we want. Reviewing is a great way to stay up to date in the literature, pay it forward in academics and advance your academic career. AI can help your readability of your study. Do not use it for reviews and make sure you check the journal policy to know what kind of statement you need to put if you use it. And that's basically it. I'm going to have to log off because I'm at a different meeting right now. However, please stay in touch. I have my contact information here. This is my contact information for NYU, but also if you have questions about the journal itself, orthoplastytoday@gmail.com is our managing editor, and we can help you that way. So please stay in touch and good luck. I look forward to seeing some of your research.
Thank you very much, Anna, for enlightening on how the editor look at the articles which are submitted to the journals. And now I'd like to call upon the speaker who will be speaking on turning clinical practices ideas into publication. So I'd like to invite Professor Dr. Karthikeyan Iyengar, who is an internationally recognized clinician, scientist, educator, and researcher who serves as an honorary professor at the Apollo Hospitals Educational and Research Foundation. With more than 400 indexed peer-reviewed publications, multiple Springer textbooks to his credit, and recognition among Stanford University's top 2% of the scientists worldwide, he has remarkable contributions to orthopedic research and education. He contributes to World Academia as deputy editor for the Journal of Clinical Orthopedics and Trauma and Apollo Medicine, and he also plays key leadership roles as Vice Chair of the Scientific Program Committee for the SICOT World Orthopedic Congress. Over to you, sir.
Thank you, Prakrit. Thanks for inviting me, everyone. So my name is Karthik. I practice in northwest of England, above Liverpool for the topography. So my aim is simple. So we have heard from Lawrence, we have heard from Anna. So Lawrence taught us how to get ideas. So I'm going to give you some tips, tricks, how to get the background knowledge, how to develop the skills, and ultimately publish. So these are my disclosure. I'm associated with all of these, but I don't have any conflict of interest. So as you, all the people here, we are all clinicians, or most of us here are clinicians. The challenge is how to integrate your clinical practice with research and publishing. Well-known barriers tend to be the knowledge, time, mentor, how to navigate a manuscript central, but I would try to helpful tell you some tips that I have had in my experience. So these are my 10 tips to navigate this challenge. We'll try to talk a few of these. Because of the time constraint, I may not be able to expand on all of these. So what do I mean by realistic publication avenues? Remember, like the hierarchy of pyramid evidence pyramid, we have types of articles as well: primary, secondary, and tertiary. This is the way to start your publishing. You start at the low point with short case reports, then go on to the secondary articles, and then build on to your cohort studies and original studies. The reason I'm pointing this out is each of these has a specific way of writing, specific impact, and therefore each are publishable, PubMed, indexed, and therefore don't disregard the tertiary for the primary articles. Second, we always have to do this. If you like a topic, there is usually something written about it in literature. So scope it down, narrow it down. If you don't know, ask your friend, ask your coach, and come to a research question. We all are clinicians, but if you have a niche, don't just stop at a case report. Go through the depth of the subject that you are involved in. So I started off with a thesis for my master's on tuberculosis. I have a keen interest on it. Started with a case report and then continued on it in surgical techniques, molecular basis of diagnosis, and now on systematic review analysis. But what I'm trying to focus is just don't focus on clinical topics. Technology is a huge way of publishing articles. Focus on systems, processes, outcomes of the patient journey across the spectrum of your clinical science. And then you can get various articles that you can publish, specifically when you have a problem with data collection. Templates, this is a key slide. The initial articles I used to get used to get desk rejected because I did not have a template. There is a free template for every type of article that you can publish, free, available online, but stick to each article that you submit with the template that is appropriate for that type of article. Article sources, these are few, and I will show you some examples. So you convert your clinical audit into an article, but that usually is a retrospective analysis. The article type or the template you should use is a strobe analysis. These are all audits, which we normally do for our appraisal revalidation in our hospitals. But the key is collect your data appropriately so that you can convert that into an effective article. Similarly, QIP can be converted into an article. Article type is you have to follow the SQUARE guidelines. Various journals publish this, but when you collect the data, make sure you stick to the guidelines and the template they provide. Case report, everyone knows about it. But the key, as Anna said, you need to have a patient consent. You need to have a consent for the clinical photographs. And it should show some new knowledge, something which is not known. So this is an example of a brachialis muscle metastasis from a colonic cancer. Was referred as a bicep rupture, hence very unusual, and it got published. So you have to look out for unusual things. Now, various other ideas can be looked into, not only the clinical things. These are some of these. I have published on all of these. For example, medical education, you can look at design, delivery, curriculum, competency-based or outcome-based analysis in undergraduate level, postgraduate level, right on examinations. And this can be a good way of supporting you as an educational supervisor or in your education career itself. As I kept mentioning earlier, just don't focus on the patient, follow the journey of the patient, look at the journey of the patient starting from his A&E, OPD, or in theater, follow it up and look at the various systems, processes, and outcomes that you apply in your healthcare will help you to write various other narrative scoping reviews or systematic reviews. I love anatomy. So we all know structures on the medial side of the knee. However, because of my interest, I developed what is one of my eponymous articles looking at the structures on the medial side of the knee, which are present in all of us, all well known. But I correlated that with clinical radiological anatomy and showing a way to approach this in a clinical practice. And there we go. Therapeutic interventions we do regularly, but search for innovative techniques. For example, this is the innovative technique for ultrasound, and you can get again eponymous articles. This is an interesting concept. Hot topic versus tradition. Traditionally is your infection, trauma that you do in clinical practice. But as you know, 3 years ago, ChatGPT came. You started to write with letters to editor, commentary, etc. Then we analyzed it, various examples, published on it. And the last one is a pivotal article because we produced an article where we compared ChatGPT generated article with our own article and found how beneficial or weak AI generated article can be. Similarly, the current last 1 or 2 years is AI. So there is a lot of articles that can be written on it. So keep looking at for the next year and the year after. Collaborative publishing is an innovative way of publishing. It expanded during COVID. I have a lot of those during the COVID. That's my collaborative network. But I have to point out here that Indo-UK collaboration is increasing and has grown substantially over the last 5 to 10 years. You can see an annual growth of nearly 20%. So collaborate amongst the country. I have done a small part in this aspect, being the top publisher from the UK, collaborating with Indian co-authors. So you can do it at your own states, in your own countries, and get a co-authorship with that. Quality versus volume always gets hard. They ask you, oh, should I publish 1 or 2 quality articles in a year or multiple articles? Listen, the way how your citation is accumulated is changing. It's called altmetrics. It depends on your social media, likes, forwards, downloads. So therefore, in a 5 years time, the spectrum, how your scholarly impact is judged is going to change. So look at hot topics as well. Along with that, have a balance of both quality and volume, and there we go. Finally, this is my algorithm of getting things published. But out of all this, there is a mnemonic I use, that is KSCPCT. K stands for knowledge, gain your background knowledge. S stands for skills, which we all can learn. But the critical 3 letters are C for commitment, P for passion, and most important of all this is time management. Thank you.
Thank you very much, sir, for your wonderful presentation, sir. Now I'd like to call upon the speaker to speak on practical and effective research methodology for a young researcher. I'd like to introduce Dr. Anna Serrano-Ardila, who is an accomplished orthopedic surgeon, educator, and emerging researcher who currently serves as an arthroscopy and arthroplasty surgeon and medical coordinator in MEX-EDS. She has developed a strong research portfolio focused on Ehlers-Danlos syndromes, hypermobility disorders, musculoskeletal instability, and patient-centered orthopedic care. Her work has been published in several peer-reviewed international journals, and she has also contributed to numerous book chapters. She is frequently invited faculty member and speaker at national and international scientific meetings, and is an active member of the SICOT Young Surgeons Committee. Now over to you, Anna.
In the next minutes, not repeatedly see on to do visible for research projects. Many research is interesting in my patients and how into our research. So we have with statistics because it's very it is not designing the stuff. The thing is, you need to start. So first, you need to identify a clinical part. then you need to convert question what, and then you can select the simple, so you can answer.
Anna, just wait a sec. I'm not sure if your voice is clear. At least I can't hear it very clearly. Is there something wrong with the microphone, or is it just me, or?
Is it better that way?
Yes. Better.
Yes, it certainly is better.
Yes.
Yeah. Thank you very much.
I'm sorry for the inconvenience.
No worries.
What I was telling you is that many surgeons face, how do I see things and how can I turn that into research? So the first part is you need to identify the pattern and then try to see a sequence. If you begin trying to pick the journal that you need to work with, this is not going to work for the first researches. So try to convert the pattern that you have seen to find the question, and then you can select what type of design is better for you and for your question. Then you can build up a data set and then decide what is the clinical message that you should communicate. This should not be perfect. The first research is not going to be perfect, but it needs to be trustworthy. So for the turning your clinical itch or curiosity into a research, the thing is, you need to be very curious. For instance, in my clinic, I see very hypermobile patients with some chronic musculoskeletal pain, and they arrive after many years of consultation with non-specific imaging, and some symptoms are across all systems. So my observation is very interesting, but that's not a research. So the next step is to have some of the variables so I can measure them. If I can measure things, then I can control some data. So before investigating something, I like to use a framework that is called FINER, which is if your question is feasible, it is interesting, it is novel for the community, it is ethical for the patient and the community, and it is relevant. So even though novel is not the whole thing, but it may be simplified if you add evidence of what you're learning and what you're experiencing in your clinical practice. Then you can use a framework called PICO or PECO, so you can have identified many elements of your research question. What are these elements? P is for population. In the case of my example, adults with hypermobile spectrum disorder or Ehlers-Danlos syndrome. E for exposure or intervention. In this case is clinical enthesitis present in my patients, and how to compare it with those who are not having any enthesitis, and which is the primary outcome. It can be pain, it can be functional, it can be return to clinic, return to activities. So you can have some elements very well identified for your clinical question. So in that case, do not write how are my hypermobile patients going with pain, but try to structure your whole research question with this type of elements. Then the next step is to go ahead on operations. And that means that words such as pain, inflammation, instability are meaningful, but they are not the research variables, until you define how you will measure them. For pain, we have a lot of scales. For function, we have also some validated scores. For enthesitis, we can use ultrasounds or other diagnoses and follow up. How are we going to follow up these patients in terms of time? You need to identify and define exactly what you will measure. And then you can choose what type of design is better for your question. So, for instance, if you want to describe a new pattern, maybe case series are going to be better for you. But if you want to measure frequency, a cross-sectional study is better for you. If you want to explore any association between two features, then a cohort or a case control study is the one that you need to pick up. So if you want to evaluate challenge. For instance, if physical therapy is better for hypermobile patients, then you maybe have prospective cohorts, and then you can go big with a trial, but that's not what I recommend for first researchers. Then the other thing is, when you have your data set or you have it planned, before collecting it, you need to divide data in 3 important aspects. What are the information that is essential? What is the information that is important? And what is the information that is interesting, but not as necessary as the other information? So with this, you need to explore who are you including and excluding, and that Anna Cohen was talking about is, how is the intervention? Do you have anything predefined? With whom are you going to compare it? And what is the primary outcome that you are going to communicate in your conclusions? So for this, for the collecting data, you need to write down. Please write down. If you're beginning with this, you need to write it down. AI is not going to do it for you. So when you do it, then you begin building your whole criteria, how to write this. Then you can compare it to the PICO or PECO question with the elements. Then you can define the outcome and the measurement tool, so you can find your better and simplest design. You can start with a case report, and that's okay. And then you can have a pilot with 10 or 5 patients to see if the plan that you are working on is really going to work with 100 or 1,000 patients. So which are my learning points? First, you need to have that clinical itch or curiosity in which you can begin to see patterns. Then have a good question with elements with the PECO or PICO framework. You need to have ethical. Ethical is very important here, and you need to know if this is relevant, novel, or feasible. Then you can define your own variables and how to measure them before even collecting data. Remember, you need to ask for help. No one has ever done something well without any help. Choose the simplest design, because it's better to begin small and then go higher, and then have a minimum setup, a data set, so you can plan with a little pilot and then go big. This is it for me. So if you have any questions, I'm happy to discuss it in the questions later. Thank you very much.
Thank you very much, Anna, for a wonderful presentation on the research methodology, which always is confusing for a young researcher. Now, the burning topic nowadays is, of course, effective use of AI in research methodology. And to speak on that, I'd like to call upon Dr. Vishnu Senthil, who is a distinguished orthopedic surgeon practicing at a leading tertiary care center in Tamil Nadu, India. Renowned for his clinical expertise and dedication to medical education, Dr. Senthil has made significant contributions to the field of orthopedics through an impressive portfolio of more than 50 indexed scientific publications. His global recognition includes the APOS SICOT Ambassador Program, the New Vesive SICOT Foundation Scholarship, and the Korean SICOT Award. He currently serves as the Vice Chair of the SICOT Education Committee. Over to you, sir.
Yeah, 1 minute.
So you can now begin your presentation.
Yeah, I'm just, thank you, Prakrit, and for the wonderful introduction. So coming to the effective and ethical use of AI in research methodology. So this is a very, very important thing, because AI is increasing day by day, and we are becoming more AI dependent than much before than this previous. So coming to AI in academic practice, so basically we are all clinicians. So why we use more and more AI? Because AI is commonly used in research, where it helps in reshaping the study design, data analysis, and also in evidence synthesis in orthopedics. Most important in publishing, where incorporating the ethical and practical implications of AI-assisted writing. And finally, it is driven into practice, wherefore it is also used nowadays for daily clinical decision making and patient care. So how many of us have already used AI in academic practice? We have been commonly using AI previously, but it has not been as exponential as the current trends and times. Commonly, it is used in literature search, the PubMed, the AI tools, the Elicit, or Grammarly was used before, like for grammar correction, in abstract writing, PowerPoint presentations, and also helping drafting the reviewer replies. So AI is a part of a research practice, but is often silently being done, but now it is being recognized as an important tool. So initially from 2022 to the current 2026, the amount of AI volume and amount of AI search engines have increased drastically, from how ChatGPT launched now to the Claude, the Gamma, and various other AIs are done. And nowadays the journal regulations and AI disclosures have become very mandate, and even journals are finding tough to how to elicit the AI duplication and how AI plays an important role in journal, various journal publications, which has been disclosed by Anna in her talk as an editor. So how AI across the medical research workflow, commonly used idea generation to find any gaps in medical research, to suggest various new hypotheses. Mainly common use is the Elicit in literature reviews, especially in systematic review and analysis. It helps to compound or reduce our time in bringing down various vast literature reviews, and ultimately to have an important study design for optimizing protocols, to improving protocols, patient selection criteria, and also utilizing the various statistics for the study design. So statistical planning. So this is a category breakdown: writing assistance, literature review, and various AI models have been used, which has been seen. So how AI truly helps? So AI truly helps in the clinical design, it helps in busy clinicians. So AI improves efficiency, especially for the busy clinicians, like faster literature summarization, better language clarity, and also abstract restructuring. So how it helps in, it is a major advantage for developing countries where English is not their native language and they use multiple languages for expressing their thoughts, and languages where English is a second language. Especially AI is using as a leveling force in global research, especially in Asia Pacific countries, because it improves readability, reduces the language barriers, enhances global publication opportunities, and helps to communicate scientific ideas better, because good science should not fail because of imperfect English. So these all are advantages or beneficiaries of using AI. So how AI can be shown? It is shown that if you give a prompt in 30 seconds, you can get a structured abstract with a fluent academic language, logical argument flow, and speed. Speed is impressive in AI generated softwares, but definitely accuracy is the responsibility of the person who employs the AI tool. So now comes the dangers. AI can sound convincing, but it can be wrong, because AI hallucinations are very, very much there. So it is imperative of the human side to correct whichever AI generated content, to verify it, because they can produce fake references, incorrect DOA, non-existing journals can be there, statistics can be invented, wrong author list can be there. So this is how you can have a fake citation with even your name and my name. We can have a fake citation with DOA, because these all are hallucinations which have to be taken control and taken to be credible by the author. Very, very important is the ethical use of AI and plagiarism. Plagiarism means not only just copying, because AI has advanced so much. There are a lot of paraphrasing tools which helps in rewording the other works, attribution, and reducing the Trunnion scores, which are the plagiarism, which commonly the journal uses the Trunnion websites are there. So help in reducing the similarity index. There is also hidden plagiarism, where the ideas are stolen and undetectable by software. And finally, intellectual ownership concerns, where intellectual data has been copied, modified by AI, and definitely we cannot know who owns the AI generated text. So that is the onus is on the responsible of the author. Low similarity score doesn't equal to ethical originality. That is a very important key message. Authorship and accountability is very, very important because AI is not an author. It cannot be held legally or professionally accountable. So it also depends upon the reviewer credibility when using AI. AI cannot take responsibility for errors or misconduct, data accuracy, reviewer queries, and final version of the manuscript should be individually checked and edited. It is just a tool to make your life easy, but it is not an author. The dangerous side of AI, there is a misuse of AI. Fake patient data is increasing, invented follow-up, fake radiological images, artificial statistics, and manipulating of the original figures from various other data sources and various other journals. So AI-generated text is been increasing about it. It is being detected more and more in articles, especially results and methodological data, and it is commonly used by non-MD authors. So definitely these AI tools and AI generated data in research is increasing time to time. Confidentiality must not be never compromised, especially patients' data should never be uploaded into AI tools. That is a very, very critical risk. Convenience should not override confidentiality. It's very, very important for a young researcher, especially X-ray images, operative photographs, case sheets and notes, identifiable data with patient information should never be uploaded into open AI platforms because they can be misused by anyone else. So now journal policies are becoming very, very strict. Elsevier, Nature, Portfolio. So definitely you have to disclose AI. So when you disclose, always be transparent. Disclose the tool which you are using and the purpose which has been used. Always be accountable. Accountability is very, very key integrated nature of an author because it helps to build in trust with the editors, reviewers, and readers. Be accountable for which you have been used AI, and finally be trustworthy. So once you use AI, you go through all the AI literature which you have done before uploading it. So make sure it is reasonable and does not have a fake information given to the readers because it is very, very important. So framework for responsible AI, always be transparent in disclosing, always verify each and every fact when you get into AI. So you are responsible. Accountability is very, very important. Confidentiality, very, very important. Never upload any data, patient data, images, photos, which can be this. And finally, which is very important for any researcher and a clinician, is the scientific integrity. And integrity of the clinician and author is very, very important because maintaining honesty in all your research activity protects your patient professional identity and credibility, which is very, very important in long run. It is also a part of the mentor and mentorship, which you convey the information to the next generation of researchers. Human oversight is non-negotiable or negotiable in this AI. AI only assists writing, but human remains responsible for the truth. Especially in researchers, when you are doing our publication, references should be always be checked. PubMed and DOA very, very must be checked. Counter check with the references through PubMed softwares, very, very important. Statistics has to be recalculated. If you have doubt, you deploy a good statistician who's a full-time statistician. Conclusions, ensure they match actual your data and methodology. There should not be fabrication in the results and conclusions. Confirm images are original, which the clinical work which you have done, and it is your images. Clinical claims, verify against established guidelines and evidence. Proper peer review, proper review by yourself into the journals. Scoping should be done before committing anything into the conclusions. AI is already used in orthopedics like the ortho evidence, the bone view, and the imagine, which is commonly done. So AI is already changing how orthopedic research is done globally. In clinical research is very, very important, and clinical disciplines need a higher caution because lives and your clinical judgment and treatment depend upon honest data. Why clinical disciplines face a higher risk, especially like orthopedic disciplines? Because patient images which are generated in AI are uniquely convincing evidence in orthopedics, and it is very, very difficult for readers to distinguish between AI generated images, that to young researchers who are coming into the field, and outcome data which is generated in AI. It is very, very difficult to verify or independently replicate and to know the authenticity. So very, very important. It is a profound ethical ethicality of the author to have provide good confidentiality and good provide good data to the researcher and the viewer or the reader. In the future, we are ready. AI assisted peer review is coming, where AI is one of the part of the peer review process, like tools like StatReviewer, automatical statistical checks to avoid AI duplication, to detection of AI duplicated images or data patterns. So completely AI will be unavoidable. Learn to use it right before it is mandated, and also in a right and ethical direction. The big question, will AI replace researchers? No, AI will not replace researchers, but who ignore AI might be left behind. AI cannot replace clinical intuition, clinical practice developed over clinical knowledge developed over a period of time, ethical judgment, genuine innovation, novel hypothesis generation, accountability, peer credibility, and the trust in science, which is very, very important. The future belongs to researchers who combine human judgment with AI efficiency and efficacy. Practical take-home recommendation: use AI for language improvement, grammar editing, especially in developing countries where English is not their mother language or mother tongue. AI is used in abstract structuring, formatting, literature research, and summarization, but do our own scoping review. Draft, especially in reviewers who do draft replying, you have to personalize, but don't upload the original manuscript into AI softwares and get the replies and then do the draft to this. So you can have a check, and suppose if you don't understand the statistics, those statistical points can be uploaded in, verify it and modulate it to a personalized way. Statistical explanation can be done if it is a complex statistic. Each and every step, disclose, verify, and take responsibility. Final thoughts and key messages: AI is a powerful tool. Use AI. Every AI output must be verified. Transparency is non-negotiable. Patient confidentiality must and cannot be compromised, because we are the persons who are going to take for legal implication. Scientific integrity is your professional identity, and identity, protect it always. Thank you, and thanks a lot for the opportunity. Disclose, verify, and always take responsibility. This is the final key message. Thank you.
Thank you very much, sir, for your wonderful presentation on the pitfalls of AI, especially, which is very important for the young researchers. Now, the equally important is how you prepare a manuscript and how you select the journal to which you are submitting your manuscript. So to speak on that, I'd like to invite Dr. Hesham Elbaseet, who is a consultant of pediatric orthopedics and traumatology at Asyut University Hospital in Egypt. He's an AO trauma faculty, and he holds multiple prominent positions within SICOT, serving on the Fellowships Committee and the Research, Education and Mentorship and Research Awards Committee. Over to you, Dr. Hesham.
Thanks a lot, Prakrit. My talk today, the final talk, is about journal selection and manuscript preparation for submission. Is the presentation visible? Okay. Learning outcomes today: introduction, files for submission, how to select the journal, their review process, and what to do after acceptance. All of us try to search for literature gap, and when you are a young surgeon, you think that you should have a highly sophisticated technique, a highly sophisticated operation that deserve to be published. Any problems that you are facing as a surgeon, other surgeons face it, you can publish it if you did not publish before. And sometimes you get surprised that what you have been thinking have been published already. Oh, I should have missed them. So you formulate your ideas through the research project to have a research proposal. And it's a good thing to follow the trend. During the COVID era, there were about 500,000 publications about COVID-related diseases and COVID-related conditions. In orthopedic surgeon, there are always current trend about customized 3D printed implants, patient-reported outcomes, the use of AI tools in orthopedics and publication. As regarding the files to be submitted to the journal, we have the title and running title, the cover letter, title page, abstract, manuscript, tables and figures, conflict of interest and agreements, and supplementary data that will not be published in the original article but can be found on the link for the journal website. The title should be impressive, attractive, and mentioning what type of the study. And the running title is just a summarization of this title. The cover letter is the official cover letter. If you have special requests or special things that, for example, if you have a preprint for your article, mentioning the author names and the corresponding author name. Title page is very important about the order of the authors, who is the corresponding authors, any contact details and or seed IDs, acknowledgement, funding, and the author contribution. Also, we can mention the clinical trial registration and local IRP number, and some journals ask for word count in the title page. Clinical trial registration is very important if you are doing human or animal studies, and local IRP ethical approval. Our seed ID is a solution for different typing of names. Sometimes we have more than first name and last name, have middle names, and journals may differ in the blank area where you put your name. So our seed ID is a very good solution to have a unified and relating your article to the seed ID, and it's a good option for journal login. Also, you can add any scientific activities like where your seed ID will be like online CV for you. The abstract is the most important part of your article. It should be concise. Most of journals restrict the word count to 100 to 100 words. Should be divided into introduction or background, hypothesis and aim, patient methods, inclusion criteria, type of the study, and the results section should put the outstanding structure, because in subscription only journals, you only have available abstract for the audience. So to have more citation, you need to have a good abstract that's attractive, that mentioning the most important information. And at the end, you have the level of evidence and the keywords. During writing the manuscript, the best option is to cite while you write. Don't write the manuscript and search for the reference at the end. That will be a hell. Use a reference application like Mendeley or EndNote, and be summarizing your results in the tables and figures according to the number of tables and figures that are allowed according to the type of the study to author guidelines. You should follow the checklist, and some journals ask you to upload this checklist according to the type of the study, like case report or systematic review or a case cohort study or whatever. You can grab the citation from PubMed or Google Scholar or journal website itself. As my dear colleague Vishnu talked about plagiarism and AI tools, you should humanize it and use manual, like using synonyms for the same rewording for the sentence you are copying from an article. And as regarding figures, you should have a very clarified figures with a good resolution, not less than dpi 300, and have a good explanation of the figures by the figure legend. If you have multiple figures, you can combine them in one single figure and put numerical numbers for each part of the figure, like this example. How to select the journal? You can select the journal by your own personal experience from the previous publication of yourself, or you can ask another colleague, or you can define whether you have the ability to pay for open access journal. You will have your article open for everybody to download it, and you will have more citation. If you don't have enough funding for this, you'd use a subscription-only journals, which allows only the abstract to be visible, and you have to pay for the whole article. Be away from the editor journals or editor publishers. And you have an idea about quartiles of the journals ranking. You can use several publisher journal finders, where you put your abstract and keywords, and you can find the relevant journals to your article. Sometimes it's not very accurate. You can sort them by best match or the first decision or the acceptance range. It can give you about an idea about the biometry of the journal itself. You can use Scopus for example, if I need an orthopedic journal in a first quartile, I will choose it, and you have a list of the results of the journals. And you can use Web of Science. You can give information about whether it's open access or subscription only or hybrid journal. And you can have links to Schemago or Scopus to see which branch of the journal, whether medicine or orthopedic surgery, and which quartile lies this journal. And the peer reviewer process has been discussed with Anna. Before you do submission, the editor checks that your article matching the author guidelines, then sends to reviewers, and you receive the comments of the reviewers. Sometimes, and most of the times, it takes a lot of time to receive response from the journals. Be patient. Decision, it's rare that you have acceptance from the first submission. Usually you have either minor or major revision, or you have rejection. Sometimes you have transfer if you get rejected. Don't be sad. See the comments if they're still available. You can refine your article with these comments, and it will be like a good review for your article, and you can resubmit again to another journal. Transfer usually to open access. If you have the ability to pay for it, you can do it. Otherwise, you'll search for another subscription journal and avoid these options. And the revision, be meticulous. Take every item of revision. Don't be scared when you have a lot of revision, a lot of comments. Step by step, respond to it. What you can modify, you can do it. What you cannot, or you need an explanation for what is a question of the reviewer, you just answer it. And sometimes you get surprised that you could accept it after a huge comments of revisions. At the end, you will have the gallery proof. You should revise it meticulously for any typing error, your affiliation, the order of the authors, and etc. And after being accepted, showcase your research at scientific activities, congresses, and webinars. Update your Google Scholar. You can upload your research to a ResearchGate and all social media platforms to have networking between orthopedic surgeons all around the world. Most of the time we receive spam emails from regulatory journals, just ignore them. And get back to the first slide. Try to find another gap of literature and another research. So to sum up our leading points, how to select your journal depends on your experience and depends on availability of open access or subscription only journals. Prepare the file needs to be submitted according to the author guidelines. Revise it meticulously before submission. Respond to reviewer comments, and thank you. This is my contact details. If anyone would like to contact me personally, you are welcome. And I am ready for any questions from the audience. Thank you.
Thank you very much, Dr. Hesham, for your wonderful presentation. And thank you all the speakers for your presentation. Now we're going on to next session, the panel discussions. I'd like to invite the expert panels. Dr. Professor Raju Vaishya is a world-renowned senior consultant orthopedic and joint replacement surgeon at Indraprastha Apollo Hospitals in New Delhi. Recognized among Stanford University's top 2% of global scientists, he plays a monumental academic role as the co-editor-in-chief of SICOT, an official journal of the international organization guiding peer-reviewed research for the global orthopedic community. I'd also like to invite Professor Ajay Malviya, who is a consultant orthopedic surgeon at Northumbria Healthcare NHS Foundation Trust and a visiting professor at the University of Sunderland. He shapes international orthopedic practice as the chair of the ISHA Research Committee and deputy editor of the Journal of Hip Preservation Surgery. Within SICOT, he serves as an executive officer and the chair of the SICOT Research Academy, where he drives international scientific excellence, innovation, and global mentorship frameworks. And I'd also like to invite Dr. Swapnil M. Kemi, who is a senior pediatric orthopedic surgeon and an associate professor based in Mumbai, who provides expert consultancy at premier institutions, including Sir H.N. Reliance Foundation Hospital and Apollo Hospitals. He specializes in complex pediatric trauma, limb deformity correction, and adolescent hip disorders. Within SICOT, he serves as the chair of the SICOT Fellowships Committee, as a member of the Digital Orthopedics and AI Committee, and the local organizing chair for the 2030 Orthopedic World Congress in Mumbai. I'd like to hand it over to Dr. Vaibhav Bagaria, sir, for the moderation of the panel discussion. Sir is a Research, Education, and Mentorship Committee chair. Over to you, sir.
Thank you, Prakrit. It's indeed a pleasure, and we had some very brilliant lectures. Since we are running late and short of time, I'll make it quick. We have got an outstanding panel here today with Ajay, Swapnil, and Professor Vaishya, and we hope that we'll be able to take all our participants back to where they started their first research. Everyone knows their success, but all of you, I would want you to go back to your first research, because that's the theme. So I'll begin with you, Dr. Raju Vaishya. Hello, sir. It's indeed a pleasure to have you here. Let me ask you this question. What makes a question worthwhile pursuing? When you see it in clinics, how do a young researcher identify that this is something that they want to take it ahead? I think we've lost Dr.
Pause and ask, why do we do this way, or can this be improved? Then that's the beginning of the worthwhile project. A good research question should be clinically relevant, feasible, and capable of changing the practice or improving your patient care.
All right. And how do they start? Swapnil, how should they start? Once they identify a question, that this is probably a gap in literature, as we had the last speaker tell about finding a gap, then how do they move forward? Do they write it down? Do they take it to a mentor? What should be the ideal process? What was it that you did when you first said that this is a research question that you want to pursue?
In an area where you have an access to reliable data. Completing a modest project successfully teaches you how to do research methodology far better than starting an over-ambitious research project that may not finish, in near future.
Fair point, sir. All of them are valuable insights on how to start. I'll move on to Swapnil asking, how should they then take it to the next level? Once they have identified a question, what should they do?
I think the first and most important part of it is to understand if this question is relevant or not. Just because a resident sees a procedure for the first time or sees a rare case in an emergency or in an elective scenario doesn't mean that it is rare. So I would take it this way, that one is I would definitely go back and read it if I were a resident at that point in time. If I'm still convinced that it is rare, I would go to the next part where I would do a literature search about it and see what exists in literature. Third is, nowadays, you need to really identify what is good literature and what is not good literature. And that is where a mentor comes in. So when you have a good researcher or an academic mentor, he will guide you what exactly needs to be read and how you can formulate your study. For example, if there is a person who's been given a distal and radius fracture as a dissertation topic, then just writing about distal and radius fractures doesn't make sense. One really needs to then look at what has not been looked at. Now, I'm sure every aspect has been looked, but then there can be certain plant constructs, there can be certain anatomical models, there can be newer things like radial replacement, which can be looked into. So just having a condition doesn't really mean that it is researchable or it is writable or it is publishable. One needs to first visualize what one is going to write, definitely understand that it is rare and required, and then understand the research gap in the issue by speaking to somebody who's senior to you, a mentor, as well as looking at literature, and that is how one takes it.
So very valid point, and I'll take this to Ajay. Ajay, Swapnil brought out a very important point about speaking to someone. And I think the mentorship, and we are a part of SICOT, how does a mentor identify a good mentee and vice versa? How does a researcher who starts with a new project approach a mentor? Is there are certain qualities that he should look into, or how should he go prepared so that interest? Most of the time people are on high pedestals. The junior most person finds it difficult to approach the person who may be the best one for it. What makes someone prepared to approach someone for a discussion?
So basically, it obviously starts with the mentee, the person who wants to actually learn. And obviously, the first step is asking the question, going to someone. And clearly, it's a brave step for someone who's very junior, where the society is very hierarchical. Yeah. But by taking that first step, that person has already shown the enthusiasm. So once the mentor sees such a person who's been brave enough to actually come over to you, then it's our responsibility. And all of us are at the stage where we are mentors. So once you identify the person who's been, who will be keen, then typically I would say you obviously direct them to whatever project they want to do, you guide them, you help them, etc. But the most important thing that they need from you is not just guidance, but time. Yeah, you can tell them something and expect them to actually come back to you, and then you don't respond to their emails or don't give them time, then it's all wasted effort. Yeah, so the most important thing one can do is give them time. Now that time obviously needs to be created from our typically quite busy diaries, and but it has to come, whether it is in during a theater session when you're having a chat, give them 10-15 minutes. Just make sure that you have gone through their proposal first, and then identify where they are going wrong. And before any project actually begins, spending time with the mentee, and then making sure that the research idea is sound, the literature search that they've done is sound, and then what sort of hypothesis they want to set up, and how they want to run the project. So these are things that the mentor will obviously guide them through. But once the project starts, again, there should be regular meetings between the mentor and the mentee, and then gradually it just builds up. And what you see is once mentees know that a mentor is actually interested and is willing to give the time, then you will get lots of trainees coming to you, and your research profile grows. And for us, in the end, we are all very, very busy clinicians, and we have got finite time. So what is in our head will be hopefully delivered by the people coming to us. And in the end, it's our responsibility as clinicians that we guide the young budding researchers who are enthusiastic. Now, some of them will be able to deliver for you. Some of them won't be able to deliver for you, because some people do lose interest. But if you are not going to give them your time and effort, then it wouldn't work.
Great points. I think, yes, it's important, and it's a two-way relationship. That's the point. It's always both mentee and mentor, and mentor should not become tormentor, and mentee should not become someone who is just losing interest at some time. We have got a question from the audience, and I'll ask Dr. Raju Vaishya, who has himself done a lot of narrative reviews. The audience wish to know, please guide us for narrative review, critical review, and literature review. So in very brief, Professor Vaishya, can you tell us what are the critical differences on a narrative review versus critical review, and what should and how should one go about it? Since we are short of time, I would want, your entire skills to be summarized into
narrative review is a broad-based review of the literature, right? Whereas the current concept review or critical review are different. Critical review critically analyzes the literature, whereas current review analyzes the literature which is most up to date with latest reference.
I think we have lost Professor Vaishya. Can anyone hear?
Yeah, basically narrative review. Dr. Vaishya, are you back?
Yes.
We lost you for a few seconds, so just carry on, please. Thank you.
So narrative review is a broad-based review of the literature where there is no definitive strategy planned to review the literature, and there is a lot of bias that may come along with it. Whereas critical review analyzes a specific topic very critically and does not go haywire, right? So it's a very focused discussion on a particular topic based on literature.
Okay. Yeah, so that's the difference between the two.
And one of the most important thing to understand is actual narrative reviews can have a very selection bias. It will be biased by my own personal ideas and preferences. And a systematic review will always be perhaps more accurate because you looked at all the literature, not just the literature that you are interested in.
Yeah, and since this seminar is about the first publication, I would not recommend this to be your first thing. You may just do it for your mentor, but I think narrative review needs to come from a place of authority who has an understanding in the subject. So those should be done. So anyone who's beginning should do systematic reviews and then move on to narrative review, which is reserved for people who are authoritative in that subject. Now, Swapnil, what are the common reasons you find that the paper gets rejected or the submissions get rejected? What are the key things that you think that which are very simple, low-hanging fruits, which we can do right to ensure that our journals, our submissions get accepted to journals?
I think nowadays the trend is changing a bit. One of the commonest reasons which I see now in the last couple of years is essentially very vaguely written titles and papers. Most of them are possibly manufactured from AI, which is the commonest reason. The second common reason is an effort which is sincere, but at the same time, not very rare. It is not a problem question. There have been solutions to it more than once in the last 20 years or so. Third and most important part is essentially how you structure the paper. Many a times your structure may not be as per the journal standards, and that is where most of these papers fail. Fourth is of course English, where there can be an issue with grammatical errors, which can be significant, following which the reviewer may get a little miffed with the way the paper has been written. And most importantly, the statistical review. Now, which statistical test you use for which particular analysis is extremely important. And many a times we tend to make a mistake with those. And that is where a paper can definitely be rejected. And last but not the least, the referencing. So if the referencing has been from good quality research, usually it's not a problem. But many a times a poorly written paper also comes out from poorly researched or rehearsed manuscripts which have been looked into. So this is what I feel nowadays seems to be the multiple issues why a paper does get rejected.
Great thoughts, and I think it's important to analyze your failures and to learn from it and not get dejected. Well, I've got so many questions to ask, but our time is very finite. So I'll just end up with asking each of you one question. What is one advice that you will give to a young researcher intending to publish? And I'll ask this question to everyone who's in there on panel in a very few words, less than a minute. One advice that you feel that is most valuable to someone intending to publish. And I'll start with Dr. Karthikeyan. He's also there on panel. One advice that you would give to researcher in less than a minute.
Project and time management.
Great. I think that's key word. Swapnil, I think he's hit the nail on the rock. Project and time management. What about you?
I think don't give up if you get rejections, and there is a reason for the rejection. Work on your weaknesses and make them into your strength.
Great thoughts. All pearls of wisdom. Ajay, your pearl of wisdom.
Collaborate with individuals who are doing similar type of research, similar type of project. Collaborate with, in the end, even you are collaborating with the trainee, and the trainer is collaborating with a group of other people. So collaborate. That's the most important thing for me.
Great. Professor Vaishya, your pearl of wisdom.
I think rejection should be taken positively, and you learn from a lot of comments which you get from expert reviewers. So as you progress in your journey of research and publication, you will gradually improve. Don't think that you will become a master in one day. Before submitting your manuscript, you must read it at least 10 times yourself. Ask your friends and colleagues to see. Every time you will find a mistake. Sometimes I do revisions before submitting 40 to 50 times with my peers and sometimes collaborators. And that's not a bad practice, because once it is published, your image goes with that publication, and you should be very, very critical about it.
Perfect. And I've seen you, sir, how meticulous you are. Perfect. And that's why you have so many publications to credit. Lawrence, pearls of wisdom from you.
Yeah, I think try to be observant in your day-to-day practice and try to generate more ideas in each of your patients that you encounter. And so every minor details can turn into a bright research idea as long as you are observant enough and also care enough for your own patients. Yeah.
Perfect. Perfect. That's very valuable. Vishnu, what would you suggest?
I would suggest that like you see in each and every case, so that you think what new can be done or how different we can contribute to the particular clinical scenario. And the second most important thing is, when you are trying your first publication, try to choose a very good journal which is highly indexed. Even though rejection comes, that is different, but try to do it in a very good journal so that you will put your effort in a constructive way and you can learn more from the reviewer comments. So each and every time you learn and you incorporate better into your subsequent research, how to do things better.
Great. I think that's very valuable. Set your bars high. Hesham, what about you? What do you think?
Okay. I advise everybody who's doing research to have the opportunity to be a corresponding author for at least one article, to know the process of submission, and so it will be a good experience that will be applied later on in future publication.
Great thoughts. I think that's important. It helps you collaborate better. Prakrit, your turn before I move to Anna, our last speaker. You're on mute, Prakrit.
I think whatever problem you face in your day-to-day practice, I think OPD or OT, and the solution to it can always be a research. So always watch out for it.
Great. Always watch out. Anna, both Annas are there. Anna, one of you.
Hi, everyone. So I think the piece of advice that I could give you is, for young surgeons and researchers, ask for help. This community, the SICOT community, is amazing. I've been having a lot of friends around here that if you ask for help, you can make things happen. Please structure your clinical questions so you can have published articles.
Brilliant. I hope I have not missed anyone. No. So brilliant, guys. And thank you for such a wonderful pearls of wisdom. And if I can sum up what all of these people have said, I think it boils down to technique, technology, and teamwork. I think we have to get a technique right, and one of the key elements is to ensure that we learn from these seminars, we learn from our peers. Technology, Vishnu had a brilliant thing about how to leverage technology. And finally, it's about teamwork, collaborating, and that's what SICOT is for. So I hope this collaboration is there, which persists. All of us here are very happy to help any of the researchers who come in, and I speak on behalf of everyone here. SICOT is one of the organizations that helps people collaborate, innovate, and excel. So please feel free to reach out. And once again, thank you to all your brilliant panelists and speakers, and my co-host Prakrit Chhetri, who's done a wonderful job. And please feel free to write to any of us here. Prakrit, any last thoughts, any last words?
Sir, I'd like to thank all the outstanding speakers and panelists for your valuable contributions and enthusiastic engagement throughout this webinar, sir. And we look forward to seeing you in our future SICOT webinar education activities as we continue to learn, collaborate, and advance orthopedic research together, sir.
Thank you. See you all, hopefully, in Kyoto in person.
Good. Thank you very much. Cheers.
And before I leave, I must also thank Sufyan and the entire education team and research team. Ajay is here for facilitating all of this thing. Thank you very much.
Thanks for organizing. Thank you.
Thank you.
Cheers.
Thank
Bye.
you. Bye. Bye.